Hello, and welcome back to Talking Sit, the podcast where we spill the kibble on all of your pets. I know I sound super excited every week, but this really is an exciting episode. And all of my guests have been amazing. This is not to discredit any of them, but I think this might be my favourite one so far. And the reason is because I would say my knowledge of pet dental health was at a zero point 0.5 out of 10 before today. And it's improved. It's improved a lot. I have learned so much because I have had the wonderful Dr. Bolu Esso, and he has just enlightened me to what is going on with animal dental health. So, yeah, please enjoy this interview. I think it is fascinating, and hopefully, along with myself, we can all do a little bit better to look after our pets' mouths. So, here is my interview with Bolu. Okay, hey, Bolu, welcome.
Thank you for having me.
How are you? Okay?
Yes, all is well. All is well in the land of Bolu. Yeah, things are moving crazy, but we're good.
Yeah, amazing. So, for anybody who doesn't know who you are, please will you introduce yourself and where people might know you from before we get chatting about today's topic?
Yeah, my name is Dr. Bolu Esso. I am a small animal locum vet in London and the greater area. I do a little bit of television work, so I've done some shows, ITV Love Your Weekend, Channel 4 Fur Babies, and BBC Pooch Perfect. And I also work with brands through social media to help educate the public, so that could be with Button Up Box and some other brands that you might have seen me with. And personally, I have my own Instagram and my own brand starting up as well, Littersense. So yeah.
Yeah, okay, I'm going to get you to talk me through that later because I leave a little area to plug things and you can tell us all about it because I'm
Most definitely.
excited to hear about it. Do you have any pets? I can't remember.
I don't. I used to have a dog. I used to have a Bichon Frise. Her name was Chelsea. She was 14 years old, and I put her to sleep 4 years ago now, which is 2022.
Oh.
Yeah, she was the love of my life. I haven't got any pets apart from my girlfriend has a dog, so technically he counts as my son. He's my adopted son, and he's a very naughty boy as well. And his name's Nacho.
Okay, well, it sounds like Nacho needs to come see me, so you can give her my number. Okay, cool. So you are here today because you are very passionate about teeth, right? Animal teeth. And I know absolutely nothing about pet dental care, and so I'm hoping that you can educate myself and listeners on how we can keep our animals' mouths happy, I guess. So I guess I'll just get you to set up with as a vet, what do you think the whole situation is today in general in terms of dental health for our pets?
Yeah, so dental healthcare in general is just so important. I think what's happened with pet care is that over the last, I'd say at least the last 20 to 30 years, we've become a lot more invested in our pets' care and their well-being. We want them to live longer. And as the data, as like the age of information, people say, as the age of information has grown, people have grown to become better pet parents and coexist better with their animals as well, and look after them a lot more. And there's so many things that we took for granted before that we weren't quite looking at. And that's both in veterinary and in the caretaker space as well. And I think one of those big issues is dentistry. A lot of the times we're over addressing all these other issues. Is my dog limping? Is my dog behaving badly? Is my dog sick? Or are they vomiting? And all these sorts of things. Whereas as we've grown as a medical specialty, we learn to understand hormonal conditions, and we learn to understand heart conditions and the variety of orthopedic conditions that could affect them, and how the most minuscule of orthopedic conditions can affect them. And most importantly, how teeth can affect our pets. And I think once we've started to pay attention to the teeth, there's all these studies that are linked to how if you're looking after your pet's teeth, especially from an early age, and you notice things from an early age, they have a considerably longer, good quality of life. So one, it can lengthen their life if you're paying attention to their dental disease, because dental disease can have a direct correlation with heart conditions and kidney issues.
Wow.
But two, even if your dog is going to have a long life, at least it has a long life free from pain if we're looking after the dental issue. So it's one of those things of just kind of getting people to look inside their pet's mouth, getting them to address that, being aware of it is all very important. And so that's a big thing now.
And just to jump in, when I interviewed Fabian, because we touched on it really quickly in general terms, he mentioned that he thinks that cats struggle quite a lot. Is that your finding as well, in terms of their kind of dental care is overlooked slightly more than other animals,
Yeah,
possibly?
I think in general, dogs are the poster boys for animal care in general. Like in terms of companion
Yeah.
pets, dogs really are the poster boys. So there's a lot of good information about dogs. There's so much information about dogs and resources, and I guess it's testament to how they were domesticated, right? And when it
Mm.
comes to cats, because they weren't necessarily domesticated in the most in the traditional sense, in terms of like how dogs were, they kind of domesticated themselves because they like the sound of us humans. We're a bit slow to pick up on their signs and their warning signs for health conditions, and dental pain is one of those, because like 1 in 2 cats will suffer with resorptive lesions, which is a very specific disease that happens in cats. So
Okay.
it's one of those things where we try and get people to look at cats a lot more, because again, cats will have this independence. A lot of people think that cats are super independent, they can take care of themselves, and because of that kind of ideology, we tend to almost not necessarily neglect cats, but overlook their pain a lot more.
Yeah, absolutely. And I think I was just thinking, as you were saying, dogs are up in our face quite a lot, right? So obviously we're like around their face and we smell their breath and you think, oh God, okay, right, something's going on. But you don't necessarily have that same level of interaction with a cat. So possibly you wouldn't even know if something was going on in the first place. They're not
Yeah,
up
I
right
mean,
by your nose.
you'd be surprised. You'd be surprised because cat owners are quite in their cat space as well. So it is very dependent on like how you are as a cat person too. And but yeah, like again, people just overlook it. And I think the biggest misconception is because a pet is still eating, then they're not necessarily painful. But they will eat through the pain. It's instinction. It's the same way as like if a cat, if a dog, if we're talking about behavior wise, that a dog might not be painful because he's still running around, doesn't necessarily mean that he's not painful or they're not
Yeah.
painful. It's just more so that they've learned to ignore the pain or override the pain. And especially when it comes to dental disease, we already know that pain over time, you increase your threshold. So you almost habituate to it. So especially when it
Yeah.
comes to chronic pain and things like that, your threshold for pain and the tolerance for pain becomes a lot larger over time the longer a condition is left to get into chronicity. So I think it's really important that we don't just use arbitrary markers of pain, such as like, oh, is she still eating? Oh, she's still walking around. Da, 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 da. We have to really be vigilant and pay attention to how they're eating, what foods have they stopped eating, what toys have they stopped playing with, like and all those small little mannerisms. Like, are they licking their lips a little bit more? That could indicate
Mhm.
that we need to kind of look inside that mouth and address what's going on.
Yeah, and I think a common one for me when I kind of say to people, oh, maybe go get a dental check, is handling issues around the face as well. So suddenly they've become like intolerant to the groomer cleaning the face or they don't want to be touched near the face and stuff as well. So as somebody who, before I met you, genuinely would never have thought really twice about dental care in animals, because I was always kind of the impression, again, that we could do management things, but it was kind of looked after on its own. Obviously, I'm wrong. I know this now. But how serious is it? Like, how bad does it get? What are we talking in terms of what happens if we leave this to fester?
Their mouth just rots. Like their mouth literally just rots away. So we're talking about like disease from the inside. So there's so many different conditions, because we can talk about from a genetic standpoint and we can talk from acquired, really and truly. So most cases that we'll see will be acquired periodontal disease. So that's like just general dental disease, right? And that gets to the point where the teeth start to decay, they start to rot. There's all this bacteria in there. There's pus. There's abscesses. There's all these kind of like loose teeth that are just basically held in by just tiny bits of flesh or tiny bits of like abscess stringy material. So it gets really bad in that situation. And when we have cases like that, when things are dead inside the body, when it's there for a long period of time, the body starts to forget that it's there until something happens. But what happens is that place becomes a breeding ground for bacteria and pathogens and deadly diseases. So what happens is that if that tooth is left in situ and it's dead and it's dying, it builds up all this bacteria. But all it takes is a sudden knock, and that could spill the bacteria into the bloodstream. And when they get spilled over into the bloodstream, then they can go everywhere. So we know that in the heart, that can cause like plaques, so endocarditis. So bacteria just kind of
Wow.
sits on the heart, and because it sits on the heart, it sits like a plaque on the valves of the heart, and that causes like increased blood pressure, but can also lead to like things like heart failure as well. We know that it can affect the kidneys because if the bacteria get into the kidneys, like so generalized sepsis in that kind of way. But more time, if anything, we're dealing with the mouth. I mean, the mouth has got a great propensity to kind of shield itself off from the rest of the body, but it still doesn't stop it from having, the more disease that gets there, the more permeable the gums become. And when the gums become permeable, that means all the bacteria can just kind of spread everywhere and just go everywhere. So like it's more than just bad breath, but the fact that they just got a rotten mouth, and like people always say that they're still eating, but it can get to the point where they stop eating, and when they stop eating, you're like, this mouth must be horrendous for them to stop eating. Like they're literally Tic Tacs held in by like by like saliva. So it's really it becomes really nasty in there, and the incredible amount of pain. Like I feel like every single human can resonate with what toothache feels like. At least once in your life, you've probably experienced toothache. Now imagine if 40 of your teeth were in that condition, or like, 20, I did a dental yesterday where I took out like 26 teeth, and you're like, that many teeth because the dog's got to 9 years old, never had a dental in its life. And it's like the breath is smelling, but it still seems okay. Well, all these teeth are loose, or they're diseased, or they're compromised, or they're no longer viable, so they need to come out. So yeah, these are kind of like worst case scenarios, like end stage periodontitis, and where all these kind of teeth need to be removed. And then you've got stuff where conditions where it's not necessarily the dog's fault or the owner's fault, or where some dogs have allergic reactions to their own plaque. So they can have allergic reactions to their own plaque, and so that can cause a lot of disease inside the mouth and inflammation and pus. And so those teeth sometimes need to come out. Then you've got things like malocclusions where the teeth might be misaligned, and that's normal in people. Like we joke about people having like munted teeth or whatever, and like where we've got malocclusions and things don't match up, and because they don't match up, it affects the bite. And so sometimes we need to remove teeth or level out teeth, or just to make the bite more comfortable. Because if they're not comfortable, then they end up like biting their lip or having fistulas or all those kind of things. So there's so many different ways in which you can look at disease of the mouth, and it could be endless if you don't stop me. So
I genuinely thought, right, okay, so two things. One, I always say to people that I deeply regret not becoming a vet before becoming a behaviourist, because then I would be able to do both, and I'd be an enigma. You've successfully reminded me why I didn't train as a vet, because that sounds absolutely disgusting and I'm really squeamish. And I can picture all of it and it just sounds horrendous. Point two was, I genuinely thought that as like a vet dentist, and I'm so sorry that you just like took out some teeth, but wow, that it's like a whole other ball game, right? By the sounds of what you're saying, like all the variability and how serious it can all get. And Christ alive, I had absolutely no idea. So you've mentioned like some of the really serious ones to look out for, but I guess if we're thinking about the average person that might be listening to this, what are the most common things that we'll see in dogs and cats, either early stage or that might kind of go unnoticed, I guess?
yeah, so we start from early stage. So usually, whenever I talk about dental disease, I kind of just go from order of like birth until old age, right?
Mhm.
And if we're talking about birth, we're talking about congenital defects. So these are things like born with too many teeth. So you're born with too many teeth, so supernumerary teeth. So that's too many teeth. They sometimes, and the biggest thing is that when they're babies and they have their baby teeth and their adult teeth are coming out, the adult tooth and the baby tooth should never be present at the same time.
Okay.
That's like a general rule of thumb. But people tend to ignore it because they think, oh, they're just teething and it's gonna fall out eventually. But the whole point of a persistent baby tooth is that it's not falling out because the mechanism for it to fall out as it should do, or exfoliate as it should do, hasn't happened. So doubled teeth. So a lot of time with dogs, we see like doubled fangs. So they have like a baby tooth, especially in like our small breeds, like our Pomeranians, our poodles,
Mhm.
we are Shih Tzus. We know that like Dachshunds, they might have that propensity to have that doubled fang. Okay, so that's one side. So supernumerary tooth, where the adult tooth and the baby tooth are sitting in the same place. So that messes up the bite, and the baby tooth has to go. We've got things like malocclusion. So like these are like when we talk about our bulldogs, or sometimes it can happen in bigger dogs as well, where they have a slightly dwarf face, but we have undershot jaw, or an overbite.
Mhm.
So those are like, that's a very easy thing to catch. Overbite, underbite. But a lot of time people see it and just like, oh, it's just a cute underbite. But really and truly, that could be causing some sort of trauma, right?
Yeah.
So there's those malocclusions. You can have it in different
Sorry,
forms.
sorry to jump in, teacher.
Go
I have a
for it.
question. So you're as like a dental specialist,
Yeah.
do you look after the jaw as well as the teeth? Just because you
So
talked about the undershot jaw, like is that something you operate on and assess and all of that stuff?
yeah, so like as in I've done dentistry because I did my dentistry certificate. It's just like a side thing. I'm not fully like because specialist is a reserve title, so I'm like a general vet that has an interest in dentistry,
Okay.
and I have a certificate in dentistry as well. So, and yeah, I still do deal with manners of the jaw. So everything is I try and describe it as maxillofacial. So everything inside the jaw and the mouth and the head. But I do everything because I'm a general vet, so I do all the whole body anyway. I just have a particular interest in that dentistry space,
Gotcha.
and specialists are really good at like going really really deep. But yeah, when it comes to dentistry, you're looking at the whole mouth and jaw. So sometimes cats get TMJ issues, which is your temporal mandibular joint, which is like the hinge on your joint. Humans get it a lot.
I have TMJ. Yep.
Exactly. So everybody has one, and then it's a matter of whether you have the issues or not with it as well. So cats can sometimes dislocate it, or sometimes there can be some pain in it and things like that. And so there's different surgeries you can do for it, especially with undershot and overshot jaws. So a specialist might correct that jaw through surgery sometimes, but a lot of the time, as a dentist, what we'll do is we'll look inside the mouth and we will see which teeth are causing the most trauma. So I had a case like this
Okay.
last week where a dog had an undershot jaw, and because of the positioning of the jaw, the canines couldn't sit in the place that they're normally supposed to sit.
Right.
So because of that, we had to extract teeth so that they could have space to sit where they normally sit.
Right.
So you have different interventional types of medicine that you can do when it comes to the teeth. So you can either go full blown extractions and take things out, or you have like orthodontics, which you're all familiar with, which is like the movement of the teeth. So when we're doing
Okay.
the orthodontics, that's when we're doing talking things like braces or you know
We don't put
braces.
braces on dogs, do we?
There can be, yeah, there can be braces and chains to move stuff around because it's the function. It's not cosmetic. It's function, right? It's why we're doing
Yeah.
it. Yeah, so braces can happen. Sometimes we do these things called we have inclined planes. So sometimes if canines are too narrow, they go into the roof of the mouth. So
Right.
an inclined plane is like we kind of put this composite material there, so it becomes like a small ramp for the teeth to constantly hit and push themselves out, so they go into the right position. So that's another world in itself. So that's orthodontics, and those are like moving, and then you've got prosthodontics. So you've got like your fillings and crowns and things that you can put on top as well. And then we're talking about like root canals as well. So root canals is something that I really want to get into, and that's another world as well of saving teeth. So yeah, there's just like so much you can do, not just the jaw, the teeth, around the teeth, the mouth.
I wonder how long before we end up getting veneers. We end up getting dogs with turkey teeth. That's going to be the dystopian future that we can look forward to.
Yeah, exactly. This is the interesting part. I think the ethics of and that's the big thing is that I think a lot of time vets will face ethics. Like with humans, the ethics gets blurred because of cosmetics. So we start to allow stuff that we didn't once allow, but with pets, at least everything we're doing, well, at least in the veterinary space, we think that everything that we're trying to do is for the betterment of the pet. So when we start talking
Yeah,
about
and there's some
veneers,
research behind.
yes. So when we start talking about veneers, that's simply cosmetic. Like, why does my dog need a Hollywood smile? The Hollywood smile is that it's functional. So we just
Yeah.
want a functional smile. And the whole thing is always function. That's what we're trying to look at is like, how does DT function? And is it functioning right the way it's supposed to be so that we're not having pain? That's the
Yeah,
biggest one.
absolutely. So, what age do these things start to show up?
Yeah, that's what I say from birth all the way till death. So from the moment they're born, puppies, and we've got things like cleft palates. So so these are puppies that are born with defects in the roof of their mouth, where there's basically a giant hole in the roof of their mouth. And if they have a hole in the
Mm.
roof of their mouth, they don't always survive because their mouth is now communicating with the nose, which means that anything that's inside the mouth can go straight to the lungs. And so that becomes like a risk of suffocation and death and aspiration. So we can see these things right from puppies. The biggest thing when I'm talking about like double teeth and malocclusions and noticing that teeth are not in the right position is usually through puberty and adolescence. So that's anywhere from 4 to 6 months, right the way through to 18 months. You can kind of see these things. But usually a lot of dental conditions, we want to get sorted before they hit a year old. And then we've got the ones that are the stragglers that we might have missed, the things that we might have missed as they're growing up. So 1, 2, 3 years old. After 3 years old, they start to develop proper plaque on their teeth, especially if we're not brushing them.
Mm.
That's when you really start to notice it. Although I'm noticing it a lot more earlier as well, probably because of the types of diets and the different types of diets that we're giving our pets. But yeah, you start to notice plaque. build up. And once we start getting into plaque territory, we start getting into perio disease, which is like disease of the gums and disease of the teeth and the gingiva. So that's when we start to see really, really bad disease, and we want to start like treating that one proactively. So scaling and polishing, extracting teeth, and teaching everybody to brush properly and the right foods, etc., etc. So right there
Wowza.
through.
So my dog is November, so he's two and a bit.
Okay.
And I would say that in the last maybe 2 months is when I've first started to notice that they weren't like sparkly white perfect anymore.
Hmm.
And yeah, so now I'm like, oh, I just want to end the call, go and buy everything and sort it all out. But yeah, so I can resonate with that because I think I've only just noticed like any sort of he doesn't have really bad breath, but on some days you just think, God, that never happened
Oof.
before.
Yeah.
And a little bit of staining as well. So I'm obviously going to ask you eventually about what to do about that because there's so much information about there. Oh, just feed them this or do this or whatever.
Hmm.
And I'll be interested to hear what your sort of gold standard is versus a lot of the misinformation that's out there. But just to carry on with the preventative, the diagnostic stuff. Are there any sort of early warning signs that we can tell people about in dogs or cats or any other animals you think are relevant that they might be able to kind of keep an eye out for now?
Yeah, so pain is pretty obvious. Like, well, I say it because I'm a vet and I've understood the language. Pain is not that obvious, but there are a lot of things that show pain. So, drooling, picking up the toys in the
Hmm.
wrong, picking up and dropping toys, like not being able to hold toys or play with toys in a certain way, eating out of one side of their mouth. So usually, if they eat, they kind of tilt their head and eat out of one side, or they try and eat, but they keep dropping it as they're eating. They're dropping it, picking up, dropping it, picking up, because they're trying to find the soft part in their mouth to keep it in. You've got things like lip licking, pouring at their mouth, drooling. I think I might have said that already. Any pus or bad smell. Bad smell is always a great indicator. I always say the nose always knows. I mean, I learned that in university. The nose always knows. So your nose will smell it first. And sometimes perio has a distinct smell to it. But again, bad breath just means that maybe they need a brushing. I mean, dog's food isn't necessarily the nicest smelling stuff, but plaque and bacteria make it smell a little bit worse. So just having a look, and there's things that we can't tell, because that's why we need extra diagnostics, and that's why, like, especially in the dentistry realm, we recommend sedation, x-rays, so we can actually have a better understanding of what's going on in the mouth and then know what to treat, because it could be so much as like the tiniest bit of the tooth is compromised or the tooth is
Hmm.
broken. So yeah, broken teeth is another thing, changing color of teeth as well. Those are all big things. And like you said, like in some diseases, there are some diseases in which the teeth might be more yellow because of their exposure when they were puppies. So this could be exposure to antibiotics at a young age, certain antibiotics at a young age, or in utero, whilst they were in their mum, they could have been exposed to a certain disease, and that can affect the enamel of the teeth and give it like kind of like a stippling, so it
Wow.
looks kind of bumpy. So all these kind of things, just look out for, and just have an idea of like, my dog's teeth don't look quite right. Cracked teeth,
Okay.
broken teeth, too many teeth, smelly teeth. You start from there, and then you just talk to your vet.
Is it kind of the same with regardless of whatever animal we're talking about?
Yeah, pretty much.
Yep.
Pretty much. I mean, when we're talking about our small furries, and that's where Fabian comes in, but like our small furries, like our guinea pigs, our hamsters, rabbits, they might be a little bit harder to find, but the smell of the teeth, the direction of the teeth, especially in terms of like our rodents, where they have, the two incisors that come to the front, if they're
Hmm.
kind of not together, they're diverging away from each other, these can all indicate disease. If they're wobbly or loose, that can all indicate disease. Usually it's from a husbandry standpoint, so they're not eating the right things. But yeah, those are all indicators, but it's same exact same thing. Drooling, smelling, all those
And in rodents, they can be overgrown, right? Is that correct? Yeah.
exactly. Yeah,
Which you
exactly.
can anyone can imagine would be horrendously painful.
Yeah,
I presume if you're kind of keeping an eye on them, you can spot that something's not quite right and
yeah.
modify something before having to do anything crazy.
Yeah, I mean, like one of the vets that won my course, I remember he's talking about a case where there was somebody who had a gerbil and the tooth had literally grown through the roof of the head. So it kind of gone, like the gerbil had turned into a narwhal essentially and had a unicorn spike because it was an abscess on its head. And when they lanced the abscess, it turned out that the tooth, the bottom incisor, had grown right through the skull out the top of the head because the teeth keep on growing because they're brachiodonts. So they just let the teeth keep
Ooh,
growing. And people
that is
didn't realize that.
crazy.
Yeah, very crazy.
Yeah, I guess I know it's hard because all animals are sentient and we have to care for all of them. But if you're a gerbil person, you're probably not doing full health checks as regularly as we're, I guess, messing about with our dogs and cats' faces. But hey, there's the lesson. Keep an eye on those things.
Precisely.
Okay, so I think I know the answer to this question, but I'm sure people will be thinking, why is dental care so expensive? Because when I removed, oh my God, I have to tell you this, I removed the dental from my dog's insurance.
Oh no,
Uh,
no! Put it back
because
now. Put it back
because because
now.
because it was so expensive, but I'm going to call them after this and say I need it back.
Yeah, quick before
So
something happens.
I know I have dental accident, but not dental disease.
Oh no,
So
no, even
no,
worse.
oh no, oh no, Cheddar, I'm so sorry. But yeah, so but the point was, so it was like £70 a month more expensive with the dental. Like
Wow.
why is dental care so, yeah, it wasn't like a £5 thing. I'm not that tight. It genuinely nearly halved my premium.
Yeah.
And the only way I could afford it was to remove the dental, because if anyone's listening, I was quoted £230 a month for my dog that year.
Wow.
So why is dental care so expensive?
Okay, so first off, if you have dental care on your insurance and it's one that covers dental disease, oh, use and abuse it. Use and abuse it, because every pet needs to get its teeth checked, needs to get that dentistry sorted. Like, as in, it's easy to think that you could just leave it, but if you're on top of it and proactive, they can have a very long life without any pain. Now, why is it so expensive? It's the cost to it, right? There's so much enveloping that whole cost, right? And I have a lot of human dentist friends, so I talk to them a lot about human dentistry. And in human dentistry, it's also notoriously expensive.
Mm.
Arguably, a lot of the stuff we're doing is a lot cheaper. So a lot of the time when we're dealing with dentals, we're dealing with cases where people haven't really paid any attention to the teeth. Okay, so imagine you hadn't brushed your teeth for 10 years and then you show up at the dentist and be like, cool, let's get the work done, doc. They were like, not so fast, buddy. Like, we got to sort out the basics here. And a lot of the times when people come to us with dental disease, it becomes a big salvage procedure. So we usually get them at like 9, 10, 11, 12, 13 years old, dog, yeah. And even if they're younger, we can still do the same thing. But you got 9 years, no matter if they're over 3 or 4 years and they haven't brushed, let's just do this as a scenario. They haven't brushed for 4 years of their life. Okay, then remember this is a human. So when they start getting to geriatric, anything over 6, we want to know that because they're going to go under anesthetic, because dogs have to go under anesthetic for dental, because we can't just sit them in a chair and say whilst we're doing all this dental procedure, right? So that's a big difference compared to humans, because with humans, you just
Yeah.
sit down, you say So first thing is that we know that they're going to have to go under an anesthetic. Anesthetic costs money because of the gas. You've got a nurse monitoring. You've got the anesthetic equipment, all the monitoring equipment, everything that goes into that costs money. So that's a package in itself. And we can all kind of understand why surgery would cost money because of and all the stuff that goes into that side of it. But prior to the anesthetic, a lot of the time we want to run bloods, especially if they're an older pet or a pet with any underlying condition. So we want to run bloods to make sure they're healthy so they can actually survive the anesthetic, because we aware that anesthetic can be a risk, but it's only a risk if a pet isn't healthy. So we often want to take bloods beforehand so that we can figure out if the pet is healthy or not, and then we can crack on with the anesthetic, right? So the blood test usually costs a bit of money. In some practices, it could be £150. Some practices, it could be up to £200 for a blood test. And that's usually a comprehensive blood test to screen what the kidneys are doing, what the liver's doing, what the red blood cells are doing, just so we know how they're going to respond to the anesthetic. Because the worst thing we're going to do is go into an anesthetic not knowing that they might have a kidney disease, or not knowing they have a liver disease, and then that patient now passes on the table because you didn't know what you were doing.
Yeah.
Now, some cases, some people will be like, I don't want to do the blood test. Fine, we can try and take this risk, but you just have to know that this is a risk, because now we don't know the information that we want to. But a lot of vets will be like, okay, we'll do that. Then we get onto the actual dental procedure itself. Dental procedure is super comprehensive. Not to mention that, one, you've got a super skilled individual that's going to sit down and do dentistry, and not all dentals are created in equal, but I would say you have a super skilled professional that's going to do it. Dentals take a lot of time because we have to sedate the animal, and then we induce them, knock them out, go under the anesthetic. Then we have to scale all the teeth. So what your dental hygienist will probably do, but usually the vet will do. Sometimes in some practices, the nurse will do it as well. Scale all the teeth. We're cleaning all the macro debris, all the major debris that's there. We're taking all that stuff off, cleaning it in between the cracks, nooks and crannies, all that sort of stuff. Cleaning it, yeah, and then once we clean it, we do a dental charting. So we're now probing every single individual tooth around the gums and around the tooth to figure out the depth and whether a tooth is diseased or not, and its mobility, how much plaque it has, staining, no staining, all that sort of stuff. And then we X-ray it in best case scenario. So we X-ray, and the reason why we have to X-ray is because, one, A dog won't tell you specifically where they're in pain, especially when it's in their mouth. Like in the human, they'll be like, oh, it's this tooth, or it's this back of the mouth, or it's the front of the mouth. So you can kind of just go straight there and have a look. With a dog, you can't tell. So you kind of have to assess everything with a broad stroke and then be very decisive and be more particular about your parameters for what constitutes a bad tooth or not. So we have to take x-rays of all the teeth. So we take x-rays of all the teeth so we can see what's going on below the surface. Because as much as you can see the pearly whites up top, when you look at the roots below the surface and the bone structure below the surface, that's when you start to see the disease. So there's parts of the bone that might get eaten away. There's roots that might get eaten away. There's roots that might have snapped. There's teeth that might be retained there. Sometimes you can get bone cysts. Sometimes you can get tumors that are there. And you won't even know because all below the surface of the gum, whereas the top of the gum might look absolutely fine. And these are things that we use to indicate what stage of periodontal disease there is. Once we've done all of that, so we've taken the bloods, we've cleaned the teeth, we've taken the x-rays, and the dog's still under sedation at this point, that's when we actually start the interceptive treatment, right? So that's when we're either taking out teeth or orthodontic treatment or prosthodontic treatment, whatever it may be. But, you know, most of the time you're trying to extract a lot of these diseased teeth. And because a lot of the time people have left it so late, you're doing a salvage procedure where you end up taking like 20 plus teeth, 30 plus teeth, or, you know, 15 teeth or 4 or 5 teeth. And a lot of time, a lot of practices grade the dentals on the severity of what you're taking out. So it could be a grade A, which is just scale and polishing. Then you've got grade B, which is kind of like taking out just the tiny incisors that are in the front, which still require a lot of effort. And then you've got like grade C, which is usually like the worst kind of grade where it's like you're taking out more than 3 or 4 teeth. And usually if you're taking out 3 or 4 teeth, you're taking out the premolars and the molars, the big teeth at the back. And those require like surgical extractions. So you have to go in there, you have to make a flap, you have to burr away bone, you have to elevate the tooth out, break the tooth into separate pieces to take out like each individual root, and then you're gonna close all that flap up. So it's like an actual. People always say, "Oh yeah, he's just pulling his teeth, just getting his teeth pulled," and I'm like, "Huh? It's really
No,
not."
I genuinely thought that, and as you're speaking, I had genuinely no idea, and maybe that's part of the problem as to why people don't look after teeth and why I cancelled my dental and all of this stuff, because the information communication out there about it is so poor. I had absolutely no idea, and I am in this industry myself,
Mm.
consider myself very well informed, and I had no clue. Like there's just no messaging out there about this.
Yeah, and the thing is, there's messaging, but I guess it's just not reaching loud enough. And I remember when I did a post about the thing is as well is that it's hard to show all this without being graphic, and a lot of these things are very graphic. And I remember I did a post about a cat's dental, and I've done one for a dog dental as well. And you kind of get to see the stages of what's going on. But then a lot of people are like, "Whoa, this was really hard to look at because I didn't realize one that it was going to get this bloody, but two that this is this invasive, and that all this is going on at the same time." Like you're like, "Whoa, wait, all this happens," and people see it, and so, and I think sometimes the information just saying it isn't enough to really convey
Yeah.
how much happens. Sometimes I think you almost have to, as human nature, we almost have to see it to believe it. You almost like you have to sit down with me, watch your dog get his dental done to be like, oh my god, this is actually a lot of work. So a lot of time in my cases, whenever I have cases or if I'm going to practice to do certain cases, I will really sit down. Like it is a bit more expensive when I do it at practices, but I will sit down with the clients and be like, look, this is what we're doing. Especially if I have the time. This is what I'm doing. This is how the x-rays look. I'll take pictures. This is what I did. This was the before. This was the after. This is what the aftercare looks like. This is what you need to take out. This is what you need to watch for. We're going to look at this again in 3 and 10 days, and maybe we go again in 6 months. That sort of, you know, because but the thing is with local practices, they get so busy, they don't always get the time to sit down and walk you through every single step of what happened because they're so inundated with everything. But yeah, there is a lot. There is a lot to it.
You almost need like someone to put together a really, really good animation so that there's not the, like a little video completely done by hand that doesn't have any actual real blood or anything. Maybe that would be really helpful if anyone's
Mm.
listening that wants a commission. What was I just going to ask you? What's the recovery like for this sort of thing? You like it sounds so invasive, and then how do you? I know remember what it was like when I've had wisdom teeth out, and I have to change everything I eat, and I have to think about cleaning it, and I have to take regular pain relief. What is the recovery like for our animals after these things?
Yeah, so pets are really quite stoic. They're so stoic, like they make it look easy. And the thing is, if they're eating with a mouthful of diseased teeth, once those diseased teeth are gone, they're in so much less pain. So the
Mm.
fact they can even eat beforehand is really like baffling. But usually after dentistry, depends on how many teeth we've taken out, but we will always take out teeth. Sometimes they'll have sutures in their mouth, and usually they'll have pain relief. So they'll have pain relief for up to like 10 days sometimes, and it'll be daily. Usually recommend doing soft food, but if they want to eat their normal food, they can, because majority of foods are quite soft unless they're on the hard kibble. But yeah, eating soft food for those first 3 days is really important. The mouth is amazing because it has a great propensity to heal because there's loads of blood vessels in the mouth. And because there's all these blood vessels in the mouth can get all this nourishment and it can heal quite quickly. So after about a week, we already start to see that some of the places where they had teeth before are already healing over and closed over, especially if it's done well. Now, in some cases, you can get like wound breakdown and like, the gum might break down. It might get a little bit infected because it's hard to keep the mouth completely clean because, dogs will put
Yeah.
their mouth in all sorts and, they'll put their mouth to all sorts. But a lot of the time they do quite well and they bounce back after like 2 weeks. They're usually like, oh, forget about it.
Oh, that's good to know. Yeah. I mean, I'm literally sat here thinking, oh, okay, I'm planning out the next 6 years of my life in terms of what we're going to be doing with his face.
This really wasn't a podcast for the people. It's for you, wasn't it? This was just free vet advice, wasn't it?
Yeah, exactly. I'm not even recording this. This is literally just a call for me. So, what is the gold standard for at-home dental care? Because, and this is kind of the next two questions, because I was always told that you didn't need to brush your pet's teeth.
Mm,
It is okay to just give them like hard chews and rope toys and feed them kibble, and that will like naturally keep them clean. Okay.
yeah.
And then I met you, and then you like said this big thing about teeth, and I was like, oh God, I'm in trouble. Okay, I need to go home and think about this. And so I started I didn't start brushing. I've started using like proven plaque removal stuff and that sort of
hmm
thing.
hmm
But now I'm here with you. What is the gold standard? What should we be doing for dogs? And if it's different to cats or if it's the same thing, then fine.
So, with regards to gold standard of care, so once upon a time, a lot of vets, even when I was doing work experience and stuff, I remember vets being like, yeah, you just give your dog some rawhide chews and some bones and it'll be absolutely fine. Just scratch off the plaque. Oh my gosh, the information has changed so much since then. Like, because one, first and foremost, like, forget what the cartoons and the TV programs say about giving your dog a bone. Don't give your dog a bone. Please don't give your dog a bone because, like, bones are one of the biggest things to cause, like, slab fractures and fractures of teeth. The big rule of thumb is if it's hard enough that you hit it on your knee and it hurts, then it's hard enough to break a dog's tooth. So that could be antlers, that could be hooves, that could be bones, that could be rawhide chews, all those things. If they're really hard, even some hard toys, they're that hard, they can probably break the teeth. So you kind of want to avoid it. Rope toys is another big no-no, which is crazy. I sound like, oh, this is no fun. But rope toys is another big no-no because that tugging can luxate teeth,
Hmm.
subluxate teeth. And sometimes actually, funny enough, when dogs chew, they can make their teeth stronger. The periodontium that holds them in place, they can make it stronger. But rope toys are supposed to be a no-no in dental school. Now, you can't always avoid all these things, fine. So the biggest gold standard is always going to be brushing. There's two ways in which we can kind of remove debris on teeth. So we can remove it mechanical or chemical, okay? Chemical is things like your toothpaste, your plaque additives, sorry. So like, like plaque off or the special foods like the Royal Canin dental foods. Those are kind of like chemical because basically they change the pH in the mouth and make it so that bacteria
Hmm.
don't want to stay in there. So all the bacteria die because all this pH is different. And then mechanical is brushing. So where we used to say about bones and rawhide chews and stuff like that, and hard food like kibble, those are mechanical debridement. So using the teeth in the nature that they're intended to, right? But we don't really recommend those things anymore. So the mechanical is more so just brushing it. Okay. So
Hmm.
using the teeth how nature intends it is one. That's how a lot of wildlife keep their teeth so clean. Like for instance, cats. When they're in the wild, they would eat mice and prey, and because they're eating on the carcasses will help scratch off the plaque and all that sort of stuff. But they could
Okay.
still get broken teeth. The thing is about teeth is that we have to brush them if we're going to look after them because plaque, the bacteria on there create a biofilm, and that film just kind of sits like a soft coating over the teeth, and then that festers, and then that grows, and that makes the teeth diseased, and that eventually hardens into calculus over time, and those becomes those hard plaque bits that you see at the back of the mouth. So all these bits are really, really important to kind of pay attention to, but brushing is always the gold standard. And if you can brush once a day, that's great. Twice, you're superb. But I just say, look, if you're brushing at least like, once or twice a week, you're doing better than probably like 95% of people out there. So just getting used to brushing is great. There's water additives you can add to the food. Sometimes there's powders and things that you can add to their food as well. But brushing is the
And
gold standard.
do those things work? So again, as a behaviourist and knowing my own dog, he's a bit handling shy. If you can't get near your animal with a toothbrush, would you say that, one of those, it's like enzymatic powder, right? That kind of like breaks up, as you say, changes the pH of the mouth. Is that better than doing nothing, or is it just not
Yes, so
effective at
there's
all?
better than doing nothing, but there's not like a panacea. There's not like a one thing solves everything, sort of thing. So using additives, great, but obviously you have to make sure that the veterinary oral health council approved. So that's the
Okay.
VOHC. So that's making sure they're approved. You can just type that into Google, VOHC, and then you can kind of get a list of all the products that are recommended. So a lot of the additives, sometimes they do work. You got to make sure though, usually it is in combination with brushing. So if you can't brush your pet's teeth, then that's why you have to have a constant line of communication with your vet, because that's when they should be having dental checks at least once a year, once every 2 years, if you can. Just get them in, get them checked at least, because if they're under sedation and then we scale them under sedation and we're scaling below the gum line as well, we're cleaning them behind the gum line, especially if they're a bit mouth shy, then we can kind of have a constant monitor on the teeth over time. And then we could just
Yeah.
take out one tooth at a time. And yes, it might mean multiple anesthetics, but the anesthetic is relatively safe when we spread it out over that period of time. What becomes more unsafe is that when they get to a late stage of life, so they get to 11, 12, 13, 14, and then we have to do a 3-4 hour anesthetic on them because of how bad their mouth is. Whereas if we just did periodic 45-minute dentals because we just have to scale their teeth, keep it clean, everybody wins, So it's that kind of, yeah, paying attention to our pet's mouth and you get establishing that connection with your vet.
Amazing. Oh God, I look forward to the insurance call after this. Okay, so you've covered the bits and pieces that do actually work. You have mentioned when they need a professional clean. Oh my God, you're like so good at succinctly covering all of my questions in one. You talked about what happens during a vet dental. I think we're almost there. Could you, I guess, give me just one case other than the gerbil, stick in your head of like an animal, the worst case that you've ever seen?
Mm, worst is hard because I feel like sometimes with worst you kind of take blame sometimes, and I don't want to do that. But like we get really bad dental disease where all the teeth have to come out, full mouth extractions. I'll give more so examples of cases where people might not realize why it's important to look in your
Mm.
pet's mouth. So these are things like our Daxies, like with consistently running noses, sometimes like yellowish discharge coming out of their nose. And I had one where I had a similar case, which is a similar condition, where a cat had been hit by a car, and because it'd been hit by a car, it got a fissure in the roof of its mouth. So, like right down the midline, the bone had separated, and that causes what we call an oronasal fistula. And it's the same with these small dogs when they have like a discharge coming from their nose, because usually what happens is that the disease or dental disease might be so bad that it's caused a hole to communicate from the mouth to the nose, because the nose sits right above the mouth. So if there's any compromise in the soft tissue there and the hard tissue there, then it will directly relate to each other. And so often that bacteria will now spread up through the nose, and the nose will spread into the mouth and vice versa. And it can cause like chronic colds, chronic rhinitis and things like that. So these are cases that I've seen before, and people don't always notice it.
Yeah.
And so it might just be very subtle as like a constantly drippy nose on one side, and it's a little bit more yellow on one side. And then that's when it's like, oh, actually, we need to still have some dental intervention here. Or like, asymmetry in the face. So I've seen some really big cases where dogs have had like recurrent abscesses for so long around their mouth or around their neck. And then you start to realize that, oh, it's actually because their teeth are messed up, and it's the pus is just looking for somewhere to drain out, and it just fills up in the soft tissue and it just explodes out of the side of the neck or on the side of the face. So these are like some of the more serious cases that I've seen.
Mm. Hmm. Yeah, I mean, you've just made me think. Give us a message of hope to end this episode with, because now I'm literally petrified, and my life is changing as of now. All of my practices are changing. So yeah, can you like? I take it these things are all completely preventable if you are just sensible and do exactly as you're told by the clever vet dentists.
Literally, yeah. Just pay attention to your pets. Pay attention. Stay tuned. Talk to your vets as well. Get a dental check. That's all you have to do. Just get a dental check, and then do the
Hmm.
dentistry. Like so, when the vet
Okay.
recommends that you do dentistry or mentions a tooth to you or says that this tooth's broken, it should probably come out. Let's not be like, oh, let's just watch it. Like, what are we watching it for? What are we waiting for? Waiting for the teeth to grow legs and walk away? Like, there's no point waiting. So there is hope. All these things are completely preventable, and it does sound scary, but it's one of those things that we just stay on top of, and they live long, healthy lives. Like, you just dental treatment is it's very benign and rewarding in the grand scheme of things. It's not heart surgery we're doing. It's like we're just fixing teeth, and if we can stay on it consistently, then there's no problem. Like, it's not a bad thing. So it's just taking care of your pet's mouth and making sure they're okay, and just like
Amazing.
really just paying attention to them. So
Yeah, oh God, I found this so interesting and so helpful to myself. So I can't imagine how everyone else must feel. So with the last couple of minutes I have for you, I was gonna normally I say, is there anything you want to plug? And people will mention like one thing, but you literally do a million things all of the time. So what would you like to tell the listeners about? And in particular, I know I want to hear about Littersense. So yeah, just go for it. The floor is yours.
wow, so many things to talk about. I'd just say just keep your eyes peeled on me. You can follow me on Instagram. That's an easy way to say it, and you can just stay tuned when I actually do post. But yeah, I've got some big plans for the year and some big projects underway, and I'm just waiting to reveal all of them bit by bit. Littersense is one of the first projects to come from 2026. So we're working with some guys, the investors, who found this litter product, which does exist on the market already, and it's basically an indicating litter. So it changes color depending on the cat's pH of the urine. I know cat's a bit of a forbidden word on a dog podcast, but
No,
it's
no, no, this is an animal podcast. It's
okay,
like most
fine.
people come on to talk about dogs, but no, I want to hear about cats as well. I have cat listeners.
Okay, fair. So yeah, so it's basically just a cat litter, and it is a litter which is fine. It's made out of silica. I wish it was biodegradable, but we're dealing with a medical grade thing, so that's the part where we compromise for the biodegradability. But it's something that can really help pet owners. So it changes color depending on the cat's urine, and if the cat's urine is normal, it also indicates normal urine. And then if it goes towards the acidic side, which could be like kidney stones or kidney failure, then it could change color to orange. Whereas if it goes towards like UTIs and urinary stones, and also like protein in the urine, which could indicate blood pressure, then it'll go more towards the blue side. And these kind of indicators, less than the colors, but more so the fact that the litter changes color than the actual collars themselves, is really important for pet owners, especially cat owners, because cats get a lot of urinary disease, a lot of kidney disease. It's great for them to have a look at that, start looking at their cat's urine monitoring, because it's so easy to miss when cats are in pain, like we described before. And sometimes they get urinary issues and go in and out of the litter box and you don't know what they're doing. Whereas if you're seeing the litter
Hmm.
changing color, you can kind of have the idea that, oh, it is it is changing here, and we need to get to the vet. And in some cases, if they've got like a chronic disease, and you put them on that litter for that time of the chronicity, then you can have a constant monitor of their urine, like, okay, my cat actually is doing better, or they're doing worse, and we need to go back to the vet and talk to it. So it's just like another tool for pet owners to have in their arsenal when it comes to looking after their cat's health. And a lot of people have asked me, does it work on dogs? And technically it's an indicator, so it works on all animals, but this is cat litter, so this one's for the cat. This one's for the cat.
Use as advised, but also whatever.
Do what you like. Do it on
Amazing.
yourself. My receptionist tried to use it herself. Yeah, everybody can use it. So yeah,
Go for it. Episode 4 on this podcast, I had a feline behaviourist. We did a cat episode. Her name is
wow,
Lucy Hoyle. She's, I would say, the best in the UK for cat behaviour. So it might be
mate.
worth messaging her, because I know as well, from a behaviour standpoint, her being a non-vet, it can be quite hard for her to gather evidence about potential pain issues. So
Mm,
that's another helpful thing for behaviourists to know.
wow.
Okay, I will put all of your socials in the description so that people can go and find you. Bolu's also on TikTok. You have quite a TikTok following, don't you?
I do, and it's funny because I'm always on there that much anymore. But yeah, I do.
But yeah, so I'll pop all of that in the description and then people can go and find you for whatever they need. Thank you so, so much for your time. That was so interesting. I have to go now because I have to go and phone my pet insurance. Um, I'm not even joking. I'm literally going to do that right now. And I will leave you to the rest of your day. Thank you
Thank
so
you so
much.
much. Thank you so much for having me. It's been a blast, and I love talking about all things dental.
Thanks again to the lovely Bolu Esso. I am so grateful for his time because I have never known anyone busier in my entire life, and that is coming from me who never stops to come up for air. Yeah, so appreciative because I've learned absolutely tons this episode, and things are going to change for me and my dog. I hope that you feel the same, and I will see you next week for another fantastic episode of Talking Sit.